Hi, everyone, and welcome back to another episode of Combating Cancer. My name is Gwen Kelly, and I'm your host. If this is your first time tuning in, I just want to say thank you so much for being here and joining this community. It means so much. A little bit of background information about me for my first time listeners here is that I was diagnosed with stage 3 astrocytoma brain cancer at the age of 19. And the reason why I wanted to create this platform is because I wanted there to be a safe and honest space for those going through active treatment, in remission, grieving the loss of a loved one, a caregiver, or someone that just wants to learn more information about cancer and how to support someone they love. Today, I have a very special guest. I have Tiffany Troso. Hi, Tiffany.
Hi, how are you?
I'm so great. I was so happy when I got an email from your team and was like, here's everything about Tiffany. And I was like, oh my gosh, she seems like an amazing guest. I couldn't wait to have her on.
Thank you so much. That's lovely. I'd love to just tell you a little bit about myself. I don't
Yeah,
even know where to start. Okay.
dive right in.
All right. So, hi, everyone. I'm Dr. Tiffany Troso Sandoval. I'm a medical oncologist. I'm so honored to be here on Gwen's podcast. I think this is a wonderful opportunity to speak to all of you and hopefully share some information that'll be helpful with you. I am a medical oncologist who specialized actually in breast and gynecological cancers, and I worked at Memorial Sloan Kettering for over 25 years. A little bit of background about me. I recently retired after having my own medical bout. It wasn't actually cancer, but it allowed me to step away for a while and realize that there was a lot more that I wanted to do to help patients in terms of education and helping to assist patients and their caregivers to get through the cancer journey with less problem, difficulty, anxiety, and stress. We'll get into this a little bit more, but essentially, as a practicing physician, I always realized that there was such a big gap between what I knew as a clinician and what I wanted the patient to understand and what information the patient was actually able to absorb and utilize during their care. And so I'm looking to fill that gap. And so here I am.
Yeah, I love that. And then I also found out that you and I have a little bit of a New York connection.
Is my New York accent coming out already?
No, not too much. I mean, my father is born and raised in New York, so I still hear it
Yeah.
all the time, especially when he's yelling at me a little bit. I'm like, oh, okay.
The faster I speak, the more Long Island you start to hear out of my voice. I'll try to keep it to a minimum for everybody.
No, I love it. It makes me feel right at home. It's great. Well, I'm super psyched that you're coming on today, and especially just your background in general is amazing. I feel like I'm very familiar with the doctor's offices and patients and having those communications with doctors. And, I got to give you a lot of credit. That is very hard work to do, especially when you have a patient like me that's coming in being like, I don't care what your advice is. This is what I want to do.
Yeah. Well, you know what? I actually applaud patients that come in and actually have a very strong idea of what they want in their care. I often noticed over thousands and thousands of patients that there were often people that came in and really just didn't know anything and weren't well educated about their cancer, which they shouldn't be expected to be. But it creates a very big gap in terms of trying to provide for them all of the information that they need to really make educated decisions. And so if a patient comes in and has actually done their own research, and whether it's right or wrong, but at least I have a starting point to start explaining things to. So I applaud you for doing that kind of work.
Thank you. Yeah, it's very difficult when you first go in and you find out you have a diagnosis because at first you're like, oh my gosh, I can't believe cancer has affected me. You never think you're going to be the one. And then
Right.
all of a sudden you're getting all of this information and you're just like, I don't know what to do. It's very overwhelming and it's very easy for people to just shut down in that moment and
Hmm.
disassociate, especially when the doctor's like, okay, this is what we're supposed to do. This is going to be the next steps. And you're just sitting there being like, oh my gosh, I can't believe I have cancer.
In retrospect, when I look back and I talk to some of my patients that I've known for many years, asking them about that first moment. And it's really true that oftentimes a physician will come in and say, okay, you have stage 2 breast cancer, and it looks like one of the lymph nodes is involved, and you're going to need this surgery and this chemo and this radiation and this anti-estrogen therapy. And the patient is sitting there, hears almost none of that, and just keeps thinking to herself, I have cancer. Am I going to die? And, the doctor is blah, 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 blah. And the patient is not even ready to receive that information. And so that's one of the things that I'm trying to address for patients at this point. I'm sure we'll get into some of my techniques and my suggestions on how to do that because it's not an easy thing. And it's actually something that you can learn.
Yeah, I mean, it's extremely hard. I was very thankful when I found out my diagnosis. I went in and saw the doctor, and my parents were actually there, and they had the voice notes app on. because I literally was just zoning out and they had to like lock in to basically be like, okay, this is what we're going to do. And then after
Hmm.
my emotions kind of settled, it was like, this is the game plan. We're going to check back in with your doctor again. But it's
Right.
very hard because you really don't know what to do. And you're like, okay, is this opinion correct? Should I be going in for a second opinion? It's my course of action. How am I trying to get myself on solid ground again?
Right. You're actually somewhat fortunate because where I worked, patients weren't allowed to audio tape us. It was
Mhm.
medical legally, you weren't allowed to do that. So what I used to do is I would take notes on what I was saying to the patient. So I'd bring in a notepad and whatever I said, I would write it down and, end up giving the patient, I would make a copy for my files and give the patient the notes to go home with so that they could review them as well. But even then, sometimes it's not enough because I'm not writing down every word and all the nuances of the things that I'm saying. And so, it's also, I like that your parents were with you. I mean, obviously you were 19, but it's super important to have a caregiver or someone with you to have another set of ears and somebody else to take note, as well as to remind you, oh, yeah, Gwen, didn't you want to ask this question? Because in the moment, you may have completely forgotten about it.
Yeah, for sure. I also sometimes too, my brother is a doctor and I will call him when I go into the appointments. Even
Right.
though I'm 23, I still bring my dad with me to my scan appointments because, he loves me and he's like, you're not going by yourself.
Right.
And I call my brother too, and we just have two sets of ears in there. And it's like, hey, what
Yep.
about this question? What about this
Yep.
question? And I'm not even focusing on anything besides what the doctor's like, hey, it's good, or this is what we need to do next. So I think it's super
Right.
important to really advocate for others that are going through this process to bring someone with you because it's always
Right.
helpful to have an extra set of ears because when you're in that mindset of, am I going to die? What am I going to do? You're not really thinking about the next questions to ask.
Exactly. And it's 100% true. And, a lot of times in my appointments, well, now I do mostly virtual, so I can have everybody up on the Zoom screen together. But in the office, I would, have patients call their family member on FaceTime, and I would just stick that down right on the desk in front of me so that they were actually almost part of the appointment. So technology is wonderful. I think some of the other things that are important for patients to think about when you're actually choosing your caregiver, assuming that you have the luxury of choosing, because not everybody does, but is to think about who in your life best fills that position. And so one of the things that I like to teach people now is that you have a whole army of people that love you and want to help you, and friends, family, clergy, what have you. But not everybody is fit or appropriate for each of those things that you need done. And so one thing I always teach my patients now is that you should sit down and make a list of all of the people that want to help that you feel comfortable being on the inside of your care. And then you have to make a list of all the things or tasks that need to be done. And actually, you can consciously choose, okay, my dad is perfect, or he's a great temperament to bring me to my scans. He keeps me calm. He'll drive me back and forth. But maybe my brother, who's happens to be a doctor, is the best person, assuming I'm choosing one, to come to my appointments because he'll know the questions to ask. And then on the other hand, I know you didn't get intravenous chemotherapy, but I often would tell patients to think about who would be the best person to have with you in the chemotherapy suite, for example. You don't want your aunt who's really excitable and nervous and fidgety in there while you're sitting there getting an infusion. You have to think about the personality type and what everybody's strengths are, and then use them to your own advantage. And so an exercise I often will do is to have a person sit down and really write down, like, well, what are the goals or the things that I must do this week? I must go to this appointment. I have to get this scan. I have to pick up my kids from dance lessons. I need to go to the supermarket, those types of things. And then help delegate out those things to other people to help. You're younger, but, especially when a patient has a family and children and and say they're caring for their mother, for example, also, there's often so many other responsibilities that a patient will have that really often need to be delegated to somebody else so the patient has enough space to heal and sleep and rest and recover. And so that's one of the things I think is really important to help patients to do.
Yeah, I think that's great. I always say that it takes a village when you're going
Mhm.
through treatment. And I love that you brought up the idea of making a list and going down. For me, I was fortunate enough where my dad was just like, hey, this is what we're doing. And
Right.
it was like,
Right.
you're not really having an option. Like, I'm jumping full throttle into this. He's always been
Hmm.
very steady, very calm. He's like, this is what we're doing, very action oriented. But I think for anyone that's out there listening where it's like, this is good advice. This is something that I could pass on to a friend that's going through something. Cause
Right.
I feel like a lot of times when you find out someone gets diagnosed, you're like, how can I help? And it's
Right.
great to be able to be like, hey, I heard about this. This has
Right.
been super helpful and successful for a lot of people. Maybe you
Hmm.
should think about doing this. And also, how can I support you? Do I fit anywhere in that list?
Right. Or help them to make that list. Because a lot of times, I flippantly joke that if somebody offers to you, hey, call me if you need anything, that's like bottomless. They're not going to call you, right? Because they don't even know what they need most of the time. There are so many people that would really like to help, but don't know how to. And so by becoming sort of the leader of your own treatment and your own cancer team, you help others to help you. And you know what? If you're not feeling well, you should also delegate your own point guard. Maybe your sister is going to take over the meal train so that, the dinners are delivered on Tuesday, Wednesday, Thursday, surrounding your chemo days so that everybody has something to eat, or that make sure that the carpool is running smoothly so that one more thing you don't have to necessarily worry about on a day-to-day basis. So, just trying to alleviate some of those responsibilities while you're getting treatment, because at this point in time, if you're on treatment and you're diagnosed with cancer, you have to put yourself first. And most women don't do that. We put everybody else first. So
Yep,
it's
I am
something that
like
you really
shaking
need.
my head for nodding in agreement for anyone that can't see me right now because that's so true. When you say like, "Oh, like call me if you need anything." It's like I'm not gonna call you. Like I don't wanna do that. I don't even know what I need,
Right.
which is why it's so important. It's like, "Hey, you know what? I can't go to the grocery store. This is a list of what I usually get. Can you please pick it up for me? Or can you make me some prepackaged meals? Or I'm really struggling just getting out of bed. Like, let's plan like a walk in the morning so I can do some
Yep.
rehab and exercise, really get those endorphins going." But it's
Yep.
so true. It's for women especially, it's like we don't wanna ask for help. We really are in the mindset of, "Okay, well, how can I help everyone else and, like, not make my cancer affect other people's lives?"
Yep.
'Cause it's so
And
true. I
just,
mean, that's what I was
yep.
doing. I was like, "I don't want to feel like this burden on people. I wanna be strong. I wanna be tough." And it's so terrible that, like, I've gone through that. Like, looking back, I'm like, "Okay, I shoulda just asked for help." But, sometimes I have
Right.
those people that, like, inserted myself in their life. They're like, "I know you well enough that you're not gonna ask for help. I'm showing up anyways." I had so many people come to my house because when I got diagnosed, when they found the tumor originally, I had a seizure, so I couldn't drive.
Mm.
People would just show up to my house, bring Caribou coffee or Starbucks, just sit there with me and say, "Hey, I know you don't feel good, but you need to socialize. You can't isolate."
Yep. Yep. Well, that's great. You got a very strong army around you. I'm glad to
Mhm.
hear that. Some of the other things, though, that some patients that might be listening don't have, a great support system. I've had many patients in my life that have their kids live across the country and they have their own families and they can't relocate to come take care of mom. Maybe their husband had passed away and their friends, they don't want to burden their friends or what have you. So it can be very challenging. But I've also found that if you spend time, really sitting down with somebody and thinking through who else they have in their life. Maybe it's somebody in your church group, at the library that you go to, or there's always somebody that we can find. And so, I ask everyone who's listening, if you don't have somebody to help you, to really try to be more introspective and think about how you can be creative to find that kind of help. And if you can't, you really can't, then you should absolutely get your doctor's office involved. Let the social worker help you set up, transportation if you need it, or food delivery if you need it, that type of thing. So there's always somebody that we can find to help you.
Yeah, and I love that because I feel like a lot of people are unaware that those are options. There's
Yeah.
definitely people out there that they're like, "Hey, I feel alone. I don't really have anyone. I'm new to the city, new to the state, and all of a sudden I got this diagnosis and I don't know what to
Yep.
do." But there are those resources out there.
Yeah. I mean, there aren't enough of them, unfortunately, but there are some. And so, a lot of times I would find out after the fact that one of my patients didn't have the support that they needed. And, it wouldn't come about until I found out that she was really nauseous after her last chemo. And I would ask her, well, did you take the medicine I gave you? No, I didn't pick it up because I don't drive and that pharmacy wouldn't deliver it to me or what have you. So, it's really important as a patient to speak up about what's going on, because it's our job as the clinician to help you solve those problems. That's all part of it. And I know it seems a lot of times in the doctor's office when we're there and, I come flying in and I'm there for 15 minutes and blah, 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 and fly back out. But it's your right as a patient to say, hey, Dr. Trosto, I have this issue and give it to me. Let me know, because I could tell you that nobody goes into oncology to be a millionaire. We're all there because we care and we love patients and we want to help people and help cure your cancer. But unfortunately, the way our system is set up, we're like running on a treadmill. And so I'm mentioning this because anybody that's listening, I want you to think about the fact that we are there to help you. We really are. We just need to know about it. And so if it means grabbing the nurse, sending a message through the portal, or grabbing my white coat before I leave the room and say, Dr. Troso, I couldn't pick up my medicine. What can we do about this?
I think if you don't speak up, they're not going to know. And that's why it's
Yeah.
so important to really prioritize yourself in situations
hmm
like this where it can be hard because it can be very overwhelming. But it's one of those things where it's like, that's why conversations like these are important because it's like, if you don't speak up, you're not going to get the help when you're going through cancer treatment. You need to be your biggest advocate because no one's going to
Right.
step in and do it for you.
It's true. Let me tell you a story that you might find interesting. I mean, this is just one example among thousands of them. But for example, I had this lovely patient that I was treating for uterine cancer. And she was in her upper 60s, I think 67. And she would come with her daughter to her appointments with me and then go to chemo. And her daughter would leave and do something else with pick up her kids and come back and get my patient. Turns out a couple weeks into the treatment, she got sick and she didn't feel well. And she had some burning with urination, and then she started getting some diarrhea. So she started to get dehydrated, but she didn't call anybody because she didn't want to bother her daughter. She figured it would just pass. I don't want to bother anybody. I don't want to be a burden. My daughter's busy. She's got her own life. I'm not going to bother her. Anyway, poor lady dehydrates, not eating well now, doesn't feel good, ends up falling, breaks her hip, ends up in the hospital for weeks, has to get treated for her dehydration, for her urinary tract infection. Now she's going to have surgery on her broken hip. She's missing her treatment because she didn't want to bother somebody. Can you imagine how the daughter felt when she found out? So, I just tell that story because it's so graphic, but yet it's so real. And I've seen scenarios like that so many times. You're not helping yourself to not tell anybody and not get the help that you need. You're not bothering your daughter. If you are, find somebody else. But I'm telling you, you're not bothering her. She wants to know.
I think a lot of times we think that, oh, it's going to be bothersome or we don't want to like inconvenience them. But the thing
Right.
is, we have to realize these people in your life love you regardless and they just want the best for you. And that's why it's so important to speak up because it's like, okay, if I knew you were dehydrated, I would have come there, I would have taken you to the hospital and we would have avoided all these things. So it's just so important to just speak up and kind of put
Right.
that ego aside a little bit.
But, it's interesting because women, again, we're not trained to do that. We're not brought up that way. We're brought up to just deal with it. And it's part of our culture and our upbringing. And it's hard. It's really hard, especially for somebody who's been, in control of everything in her life for her entire life. And now all of a sudden she's so vulnerable. So it's a real mindset switch that you have to make. So that's why I like to talk about this a lot, because I think people don't necessarily even acknowledge that this is going on because they don't realize it.
Yeah, for sure. It's one of those things that you don't realize it until you look back and you're like, oh, wow, I was doing that and I shouldn't have done that. So I want to get more into a little bit about you. I know you have a book upcoming after you stop being a little bit too picky with your edits.
Well, it's at the editor, and they told me that when they send it back to me, the document's going to be locked, so I can't make any more changes. So, yeah, so I started writing this book about 2.5 years ago while I was still in practice, and it really came out of my own practice. In fact, my dedication page is to my patients for all that I learned from them, because although I impart all of the information that I know, it's a walk through oncology from the moment you know something's wrong all the way through your workup, there's different scans you'll get, how to organize yourself, the pathology report, how to read it. I go through different treatments and all the way up through surgery, survivorship, all of that. And the things that I put in that book, the information I knew that people needed came from the questions my patients would ask me, or the things that I needed to explain or re-explain to my own patients, because it showed me where the understanding gaps were. And so this book is really a compilation of all of my years of practice, my expertise, and it's written for the average patient. In other words, what I mean by that, you don't have to be a rocket scientist. You don't have to have done years of medical school to read this. It's written for the patient that walks into the room that can read, obviously, but that really doesn't know much of anything and really wants to more thoroughly understand what exactly they're going through and why they're going through it, what treatments and why, and that sort of thing. Because in my opinion, the more that you know, the more educated you are about these things, the better you can participate in your own care. I could just tell you a little story. I had a woman that came to me, I'm at Sloan Kettering, so we saw lots of second opinions. And a woman had come to me, like younger woman, 40s, with her husband. They were only married about 10 years or so. And she had ovarian cancer and she had had a major surgery and they removed her ovaries and all the tumors. And then she had to start getting chemotherapy. And so she came for a second opinion at that point. But the reason she came for a second opinion was because she was upset and angry with the physician that she had been seeing. Because after the surgery, the doctor said, we should do another scan because your insides look different now that you've had surgery. And we need a baseline scan. And the doctor ordered a CT scan of the chest, abdomen, and pelvis. And the patient was up in arms and really upset because her doctor wouldn't order a PET scan because everybody she knows told her that she needs the PET scan. A PET scan's the best test. Why aren't you getting a PET scan? And that's what everybody's advice to her was. And the doctor just said, no, you don't need a PET scan. You're getting a CAT scan. And that was it. Unfortunately, that was a really bad situation for her because it was a chance for that doctor to explain to her why. And if you don't know why, then you spiral, right? And so she left the doctor, came for a second opinion, and was demanding a PET scan. Okay, here's the story. And I would explain to her that you just had surgery and the PET scan is sugar, radioactive sugar that's given into the vein and it gets taken up by things that are growing quickly. Therefore, it will be taken up by cancer. The sugar is also absorbed by things that are healing, things that are bleeding, things that are infected, right? So if you just had surgery and somebody was all in your belly and removing organs and flipping and cleaning, you can imagine how much inflammation there is in the belly. So a PET scan is not the appropriate scan at that point in time because it wouldn't give you enough information. It wouldn't give you all the information that you need. Whereas a plain CT scan or an MRI scan shows you the anatomy differently. It doesn't take the sugar. It's a different technique and a different test. Sometimes we do them together. Sometimes we'll do an MRI and a PET scan, but you can understand that you don't do a PET scan after a big ovarian cancer surgery because you won't have any clarity on what's going on there. And once I explained that to the patient and her husband, they were like, I don't know. But to think that this poor lady for 2 weeks while she was waiting to get her second opinion and didn't go get her scan that she needed was all because nobody explained it to her. And so that's where the basis of this book comes from. That, you really, if you understand a little bit more and even know what questions to ask, you'll have a much better, easier time with your cancer journey and your involvement with the medical system.
Yeah, I think your book is going to be fantastic. I always say that knowledge is power. And I feel like the more information you know and you kind of do the research on your own, you feel more comfortable in what's
Yep.
going on. Because I always say you can't have a lot of control over cancer, but you can have control over how you react
Yep.
and what you research on your own. So I think it's important to have those things. And I am super thrilled to read this book myself because
Yay. I'm trying to see if here it is. I don't think you probably can't see it. We can put it in the show notes. So the book is called Calming the Cancer Chaos, an oncologist guide for women to understand, organize, and take control of their cancer care.
that's
Yay.
amazing.
Yeah, I'm so excited about it. It's like a dream come true for me to get this out into the world. I wrote the book that I wish I had to give every single one of my patients when they were first diagnosed. Although there's plenty to read in here and to understand even after diagnosis, while you're in treatment, even survivorship, because I do go through some of that. So I'm hoping that this helps so many people. I really do.
I think it's gonna be great. That is definitely something while I was going through& I would have picked that up at Barnes& and Noble and been like, "Yes, this is it. This is the roadmap that I'm looking for. This is the steps I should be taking. Here are the things I should be aware of." I think it's gonna be great. It's gonna help so many people, and when it
Thank
officially
you.
comes out, I can't wait to promote it to everyone
Oh,
of these listeners and the followers because I think it'll be super helpful.
That's wonderful. And I hope Barnes and Noble's heard that because I don't know that they're going to be carrying my book, but they'll definitely be on Amazon. And I'm working on it. This is a grassroots type of a thing. Doctors don't come out of practice and then have big PR firms promoting them when they write their first book. So hopefully I can get it out there and somebody will help me get it out further. So
Fingers crossed. I'll be
fingers
hoping that
crossed.
goes
You know
into Barnes
anybody
and
at Barnes and
Noble.
Nobles? Yeah, let them know. They should be looking for me.
Well, before we wrap up, I just want to say like this conversation has been so refreshing to speak to someone that has been in the fields and knows what it's like to tell someone about their diagnosis. And just, I think it was really important that you mentioned that, hey, we care. We're not in this for the money. I know that we only see you for about 15 minutes, but we want to help you and do all
Mhm.
that we can. Because I think that's really important to remind people that are in the offices that it's like, hey, I know you're waiting a while, but like, I care about you and we're trying to help you have a long life.
Yep.
So I just think
Yes.
that's super amazing. And I just want to know if there's any last advice you want to give to anyone that you wish you could give patients like right away.
Make sure that you're advocating for yourself, even if it doesn't feel comfortable. Unfortunately, it sounds crazy to say, but the squeaky wheel gets the attention, right? And so I don't want you to suffer in silence. And I want to hear from you. And in my book, I goes through, for example, how to communicate with your physician and how to advocate for yourself and how to ask certain questions in a certain way. I'm actually giving a workshop on that in a couple of weeks as well. So I can share that information with you happily. So if anybody's looking for me, I have a new website. It's www.drtiffanytroso.com. So drtiffanytroso.com. And from there, you can sign up for my early interest list for my book. You can sign up for my private community where I communicate with lots of patients and help have communications between each other. And I have lots of other stuff that's coming out. So I would love to have you guys on my email list so that I can help as many people as possible.
That's amazing. I will be going and subscribing right after this.
Oh, thank you, Gwen. This was so lovely.
Yeah, I was so thrilled that I got to meet you. You are a fantastic person, and I
Thank
just
you.
love the work. And anyone that does advocacy, they're my best friend now. So
Aw, thank you. All the best to you.
you too. Well, that is the end of today's episode of Combating Cancer. As always, if this resonated with you or you feel like someone else would benefit from this, please share it and be on the lookout for Tiffany's book. But if you or someone you know want to come on and share your story or you have a business inquiry, please feel free to reach out to me. My door is always open, even if you just want to chat or ask some questions. But that is all I have for you guys today. I will chat with you all next Wednesday.